We are covering point-of-care testing, often abbreviated as POCT, a critical topic that accounts for 5 to 10% of your phlebotomy certification exam. This involves performing laboratory tests at or near the site of patient care, providing rapid results that can guide immediate treatment decisions. For the exam, you must be familiar with the most common POCT devices, such as glucose meters for diabetes management, hemoglobin analyzers for anemia screening, NRN testing for coagulation monitoring, rapid HCG tests for pregnancy, and troponin tests to assess for cardiac injury. These tests are typically classified as CLIA-waived, which means they are considered simple to perform and have a low risk of providing an incorrect result. The exam will test your understanding of this classification. A common question format might present a list of tests and ask which one is typically performed as a CLIA-waived point-of-care test. An important exam trap to avoid is believing that waived means unregulated. This is incorrect. All POCT, regardless of its waived status, requires strict adherence to quality control protocols. You must know that quality control, or QC, must be performed according to the manufacturer's guidelines, which often means at the beginning of each day or shift, and whenever a new batch of supplies is opened. An exam question might describe a scenario where a glucose meter's QC was last run 12 hours ago, and your first step before patient testing must be to run the required QC. Another critical area tested is operator certification. Only trained and authorized personnel can perform POCT. Your competency must be documented upon initial training and then reassessed annually. The exam might give you a situation where a colleague asks you to perform a test on a device you're not certified on. The only correct action is to refuse and notify them you are not trained for that specific instrument. Accurate documentation is just as crucial as the test itself. Every result must be meticulously recorded in the patient's chart, including the patient's full name, the date and time of the test, the result, and the operator's unique identifier. Finally, be prepared for questions on common POCT errors, which are almost always pre-analytical. The biggest source of error is improper patient identification. Other frequent mistakes include using an incorrect sample collection technique, like milking the finger for a capillary stick, which can dilute the blood with tissue fluid and cause falsely low results. Using expired reagents or test strips is another classic exam trap. To help you remember the core principles, use the mnemonic QCD for POCT, quality control first, certification to perform, and documentation always. Following this simple rule covers the most heavily tested procedural aspects of point-of-care testing. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.